as a health practitioner in the course of the year, you've had several experiences. Let's begin with some of your colleagues choosing to practice elsewhere in the world, the Japa syndrome. How did that impact the health sector?
Okay. First of all, I will quickly make mention of the definition of the health itself. Then I will now talk about the Japa syndrome and how it has affected the health sector in this part of the country. So we all know that World Health Organization describes or defines health as a state of complete physical, mental, and social well-being, and not ordinarily the absence of disease, of infirmity in the body. So when we talk about this Japa syndrome and healthcare, you know, in healthcare sector, we need experienced people and people that are skillful to actually take care of the health of the people of a particular nation. So in the year 2023, I don't know the exact figure, but a lot of our colleagues, a lot of friends, they've traveled abroad for greener pasture. The reason purposely is that they feel that they are not well paid. That's the reason they have to seek for greener pasture. But what has been the effect here? You know, the ratio of a doctor to patient has actually, let me say it has increased. Like maybe we expect that a doctor to like 500 or less than that. The number of a ratio of a doctor to patient now is so much that, in fact, the little doctors, those doctors that are available, it poses stress on them. So it's not something that we have to tell anybody. Japa syndrome has actually impacted and affected the health sector so much, in the sense that even in those hospitals, both general hospital and then private sectors, there is no doctors. There are no doctors to handle these places. So we only then they've given the health of the nation to quacks. Anybody that you can just find, any area that you can just find help, that's where people now turn to take care of their health.
You know, according to the World Health Organization, the statistics for Nigeria is the ratio of patient to doctor is 1 to 10,000, and that's alarming. You just painted the picture now. But what do you think can be done? Because when you talk about brain drain, you also talk about the gain. How do we come up with a gain from this, or how can this situation be managed to ensure that the ratio of doctor to patient is improved as far as Nigeria is concerned?
Thank you, sir. Now, that problem you mentioned is just the shortage of health workers. That's what we are facing now. And then, before we can be looking for solution, first of all, why are these people moving? The main purpose where they are moving is that their welfare is not 100%. I have friends that moved to Saudi Arabia. This friend of mine is able to save up to like 500,000, though it's small compared to other sector. But he's happy because he's able to save up to like 500,000. That is in saving.
Naira or dollars?
500,000 naira as a saving. But for doctors working here, their monthly salary per month, some of them is not up to 300,000. So now the major problem is the welfare. If the doctors available and those that Nigeria is going to produce, if the nation or the government they are working with, or the private sector they are working with, they can take care of their needs in terms of accommodation first, then take care of some their health issues, taken care of, because sometimes you say doctor's sick and then because he doesn't have money, then he just die anyhow. Even the hospital he's working with cannot even help him because the doctor is not financially buoyant. So taking care of their accommodation, taking care of their health, those are very, very important. And then you should pay them according to the level of their skills. Once that is done, many people will have that boldness to stay behind.
Okay, in being able to access medical care, if not just for the patients, but even doctors too, because they're human beings and so they may fall ill sometimes. The National Health Insurance Scheme, NHIS, was introduced some years ago, which is, I think, NHIE right now. Now, how much of improvement has that brought into the health sector in terms of people being able to access medical care?
Well, talking about the health insurance, number one thing is the awareness. who are these people that really need this insurance? You know, we are talking of the grassroots, we are talking of the primary health care. One, there is fear for these people that we are talking about. Okay, you are a doctor, you are an accountant, you are this, then you are aware of this thing, but people that really need this, they are not aware. Then for those that are aware too, because we work there, for those that are aware, sometimes the needed medications are not available, you know, and then in some other places, private sectors, you know, some people can be on the silver, gold. It depends on the level. Are you getting me, of your, let me say, your money, how much your tax, or how much you are paying? That will depend on the amount you are going to access from the healthcare. So it has improved, it has helped to some extent, but it has not covered because some people are not aware of this insurance. They are not aware, maybe because of the level of their education, and then nobody makes them to know. So it has not 100% worked out as we expected.
Paint a picture of some of your challenges, especially when it comes to infrastructural deficit that exists in that sector, that makes it difficult for doctors, you know, to be able to carry out their work. Paint a picture of how it's been, and then what are other challenges, you know, that stray the year 2023 for you and your colleagues?
Yeah. So as we've been saying, the first one we mentioned was the shortage of health workers. This one is in terms of infrastructure. So when we talk about infrastructure in this part of the country and this year 2023, is not so, we have problem with the infrastructure. Those materials, resources needed in terms of equipment is not available in most of the hospitals. It's not available. That makes the doctors to begin to rack their brain on how they are going to solve the problems. For example, let me just say as simple as the instrument we call glucometer, maybe to check the blood sugar. Understand? If a patient comes as an emergency, at least the doctor knows that this is what I need to do. But when the equipment is not available, is a problem to the doctor. The doctor now begins to rack his brain using his medical equipment to solve this problem. There are some instruments, we call them monitor, that can check the patient's blood pressure, at the same time check the respiration, check the pulse, check everything, just as at a point. But these things are expensive. Some even, maybe some tertiary institutions, they cannot afford it. In the sense that these monitors, patients supposed to have a monitor to himself or herself. Maybe you have 200 beds, each bed is supposed to have one. But it is so bad to the extent that in some hospital, you can only have one. That is only relegated to inside the theater. So from carrying those ones from, even if you tell you that don't touch it, it's meant for the theater, then leave the doctors to be racking his brain and the nurses, and then, so it makes work difficult during the year. And then if there is going to be improvement on it, that will make the work a lot easier.
We also saw in this year the prices of drugs, medications skyrocket. Now, there are some medication that usually you want to get them before it's sold at a particular rate, but more for some, even as high as 200% increase. How's that impacting the ability of patients getting this medication, and what can be done? We do have some laboratories in Nigeria, local laboratories that manufacture some drugs.
Yeah, that's, it's like, it meets, that situation, it caught us or it meets us unaware. It happens to everybody. So I think the result of that, I think, is as a result of the exchange rates at some points in time. So immediately the increase in exchange rate comes in, it affects every part of the sector. Well, as we know, in this part of the country, we take advantage of some situation. Like, even though when you got those drugs, maybe cheaper when you got them, then your brain will be telling you that I got this at the rate of 4,000. Now it's being sold for 15,000. Then such person will not sell at the rates, at the selling price or the cost price. So you know that I'm going to get this drug again. Then everyone is going to increase the price of the drugs. So I don't actually know where the problem comes from, but The one I can say is as a result of the increase in exchange rate. So that is where the problem actually comes from.
But since we have local laboratories, can't some of these drugs manufactured abroad be made here? Wouldn't they be cheaper?
It will be cheaper, outrightly. It will be cheaper, but I don't know our kind of mindsets, most people, because this thing, we've been preaching it, talking about it over time, that we'll be preaching it and then talking about it over time, that we should go after the locally made things, but people still believe that those are not 100% okay, that it has to be from abroad. We believe the one made from Germany, made from America, and then people that can afford it, they still go for it.
All right, as we approach 2024, what are the things you feel the federal government should focus on, or your recommendations to the federal government as regards that sector as we approach the coming year that should be done to ensure that people have access to basic health care in Nigeria?
Okay, the federal government, the first thing they should do is that they should look at the primary health care. They should equip the place very well. There are some areas, maybe riverine areas, and then there are some places that destitute, a lot of people live. They should go there, plant, maybe general federal government and then the state government, they should go there, ensure that there is a healthcare sector there. There should be an hospital there, which there is a skilled and experienced doctors being located in such place. Pay those doctors very well so that they will not move away. Give them a very good accommodations. So if that is done, that is what I'm trying to say, is that they should increase the investment in the health sector, and then it will spread all over the federation. I think that will help so much.